So I'm in the Public Health Department in Ayrshire and Arran, and we've got the lead for taking forward child poverty and welfare reform and things like that in the board. And I'm it for child poverty action plans in particular. So just to set the scene for Ayrshire and Arran, for folk that aren't aware, there's the One Health Board. We've got 3 local authority partnerships and 3 health and social care partnerships. East Ayrshire, North Ayrshire and South Ayrshire. And North Ayrshire is one of the, I think the second, has got the second highest level of child poverty, depending which measure you look at. So we've got, and South Ayrshire might be one of the lowest. So we've got quite a spread across our local authorities in terms of child poverty, noting that we've got pockets of extremely high child poverty even in South Ayrshire councils. And I suppose the thing to say when you're working with the 3 partnerships, and some of my partners are here in the room, I've got representatives from North Ayrshire and East Ayrshire here in the room with us. We've all taken, so I'm working with each of my partners in producing a child poverty action report, and each of those 3 groupings have taken a slightly different approach. But we're all moving towards the same aim, which of course is producing the child poverty action report, but also mindful of the fact that, as the previous speakers have said, we've got a lot that we're already doing. We're doing a lot of good work. We've got things like in North Ayrshire, we've got the practitioners, the Fairfall practitioners, which is a little bit like the group you were talking about. We've got other aspects that everybody in the room will have seen already themselves. So we've got 3 different approaches. We've got 3 different working groups, so I'm quite tightly embedded in one of the local authorities and pushing forward that work, maybe less so in one of the others and somewhere in the middle for the third one, you know. We've got 3 different submission timelines as well, so my colleagues in South Ayrshire that I was working with, we've already done our plan. It's done. It's been through the CPP board, and that's it, ready to go, apparently. I think we're noting that it's a live document and that other things may happen in the next 6 to 8 to 9 months, and so there's still that scope to add. So it's done, but it's a living document, I suppose, is the best way of saying it. And it's capturing all the good work that's been on in South Ayrshire already. The interesting thing is that we've got 4 different governance routes to adhere to. So we've got each of the 3 local authorities, and we've got the NHS board as well. There's a nice structured way for our local authority partners to do, and not quite so clear-cut in the NHS just yet, but we will push forward with that. I suppose the other thing to say, to additional context, is that in Ayrshire and Arran we have got about 20,000 children living in poverty by the most recent data, and we've got a mixture of urban areas, and we've also got some remote and rural areas too. So we've got a bit of everything across the Ayrshires, and that dictates the kind of actions that we can work with. So I suppose one of the things that occurred that was important for us was about engagement. And when I was asked to come and do a little talk, Hannah said, "Look at it from your perspective, Regina." So this is very much from Regina's perspective. So for me, the big thing was trying to engage with the senior strategic decision makers as early as possible. And to that end, we took a paper to the board, to the NHS board, this time last year. And we wanted to be very clear to our board members. So that's the NHS board, but there's elected members from each of the 3 local authorities sitting around the table as well, and various other folk. So and local businesses represented around the table as well. And it was one of the few times apparently that a paper that we wrote that had like 6 recommendations to deal with child poverty from the NHS's perspective, it was the first time that all 6 of those recommendations were, validated and approved by the board. There was no quibble. The board was very much on board, no pun intended. So that was important to get the NHS board and get some key actions for us. And if we have time, I'll tell you what those actions are that I'm taking forward. But the other people we've engaged with across the 3 local authorities is with the elected members, and we did a nice development session with elected members in East Ayrshire, and that again is about getting the senior decision makers on board and involved. We've also done some CPP development sessions. We've also done sort of locality groups planning development sessions too, and there's representations around each of the children's services groups from public health, and therefore we're able to engage and talk about child poverty in each of those venues as well. In Ayrshire, we've got a pan-Ayrshire group that's across all 3 of the local authority areas, and it's got a lovely title. It's the Infant, Children, Young People's Transformational Change Programme Board. And I tried every which way. I can't make an interesting acronym out of it, so that's what it is. But the good thing about this board is that it is pan-Ayrshire. So we've got the senior service leads from education from 3 areas, 3 local authority areas. We've got early years people from the health and social care partnerships. We've got maternity, we've got paediatrics, we've got public health. And that's an interesting body because we've got all that learned and experience and expertise sitting around the table. And one of the work programs from that board is child poverty. And so that's one of the boards that I report into about child poverty. In terms of challenges and opportunities, one of the big things, and Sonia and I have talked about this before, and it's about consistent messaging. And I would echo some of the things that my colleagues at the table here have said, is that I'm quite surprised when I go to some of these very senior strategic meetings and I give a little presentation about the difference between the causes and the consequences of child poverty. And every single time, somebody at one of the tables or after presentation will say to me, it's lifestyle. You know, what do we do about mums and dads that are drinking and gambling and shooting up drugs? And it's their choice not to provide for their children. So we've talked about this before, Sonia and I, in the public health context, about if we do nothing else, it's about getting those consistent messages out about the differences between causes and consequences. And then ditto, the same view is about, you know, if we can distill it down to the 3 things we can do, even though they're huge areas, but as a take-home message for elected members or for partnerships, colleagues and the like, 3 things we can do to get rid of child poverty, you know, maximisation of income and reducing costs of living. So every opportunity, when I went to all those boards in the previous slide, that's what I was trying to, you know, let them come away from that meeting thinking, this is the cause of the consequences, these are things we can do. In terms of pan-Ayrshire opportunities, so the NHS is able to do things pan-Ayrshire. So we've got a staff body of about 12,000. And, you know, if we can harness those staff to bring those messages out as well, we're doing well. So in terms of what we've done already, we've got a colleague of mine in public health, Marlene, has developed referral pathways for financial inclusion services. And at the moment, she's going on a road show with colleagues from the South Health and Social Care Partnership, and basically going out to health visitors and early years staff and saying, this is the referral pathway, and engaging with them really as directly as she can do. So that's a very key workforce that will be able to use the referral tool and bring parents, direct parents to the right place. CPD sessions, something we can do pan-Ayrshire as well, and we did one of those just the other week. And then the other thing, pan-Ayrshire, is about a communications plan. So we're working on a communications plan about child poverty welfare reform for all the staff in NHS Ayrshire and Arran. But as I said, that's 12,000 people, and they can also bring those messages further beyond their immediate day job. We've already talked about data this morning and about the issues about it, so I won't highlight that again. But the one thing I was going to talk about was the mapping side of things. So my colleagues in North Ayrshire have got an impressive mapping tool and platform, and I've just got 1 or 2 slides to show you about that, because, you know, when you speak to people and elected members and the like, or the public, having a picture, having a map, having an image is really good for highlighting to folk where your problems lie, and it's really a much more useful planning tool for services rather than our 4 income-based targets that we're trying to ultimately hit. So my colleague Damien Griffith in North Ayrshire kindly shared this with me. So that's a bit of urban. Sonia might recognise that. It's a bit of urban, and this is this particular package. And I'm not saying this is the package, but it's a very useful tool. And what it does is it splits your geographical area into, on the basis of something like 60 characteristics, whether or not people are affluent achievers. So all these lovely dark green stuff, an affluent achiever, and then the pink and the red stuff is people living in financially stretched or urban adversity. So that's fine, and that's a platform that's available nationally. And but the interesting thing is that what we can do is then overlay it with, in this case, this is free school meals uptake. So that really helps you zero in on what's going on. And of course, there's a tight correlation between those 2 things. So people living in urban adversity or who are financially stressed have got higher free school meals uptake. But we can overlay that with all the data collected in that local authority. But also we're looking at how we can overlay it with NHS data as well, hospital admissions, A&E admissions, things like that. And I was just going to finish off by talking about something from a public health perspective, and that's regional working. So in the west of Scotland, we're slowly at the start of looking at things where we can do things on a regional basis. And the west of Scotland is ourselves in Ayrshire, it's D&G, it's Lanarkshire, and it's Greater Glasgow and Clyde. And we had a sort of a brainstorming session, I suppose, at the start of October, and child poverty was one of our topics. What can we do around child poverty at a regional basis? I suppose that the outshot of that was that there's only so much we can do, because of course we're very much interested in what we can do locally to tackle child poverty, and we're still at the early stage of having those discussions. But things that did come out of that meeting was an agreement that we need to think about consistent messaging, and I've already talked about that. The other thing is about having critical friends, and actually when I was watching the presentation about the Knowledge Hub, it occurred to me that's another route where we can, because I've got some actions to take forward from my board, and it would be the world according to me, but it would be nice if I had some critical friends and other brains to bounce ideas off. And I think that at the west of Scotland we were already thinking about that, but with the Knowledge Hub I think there's an opportunity to do that as well. And we did talk about exploring regional communications plans. I'm not sure what that would really look like, but it's something that's on our agenda. And then just the last thing to mention from an NHS kind of perspective is people will be aware of the new national public health priorities. And some of them, in fact most of them, are kind of relevant to child poverty, but there's two in particular. There's one about early years, that's one of our priorities, and then another one is about sustainable economies and reducing inequalities. And that's also gathering together the might of the entire public service workforce, and even beyond that, to tackle issues, and that would include child poverty. So I suppose that was where I would stop now. Thank you.